And Marion is the Senior Manager for Operations Testing at the South African National Blood Service. Good evening to you, Marion. This sounds like quite a novel idea. How exactly will it work?
Oh, evening to you, Thami. Yes, okay. Convalescent plasma therapy is a process of providing, as you said, antibodies passively to the patient. So how it works is when a patient becomes infected to the virus that causes COVID-19, their immune system antibodies fight the virus, the patient can get better. These antibodies remain in the patient's plasma, the sort of clear liquid part of the blood, for many months. So after a patient has recovered from COVID-19 and has been symptom-free for about 28 days, they can donate their plasma at the blood service. This plasma that contains the antibodies can then be transfused to another patient who is currently ill with COVID-19. The neutralizing antibodies in the plasma should fight the virus in the patient's body while the patient's body is still developing their own antibodies. And by doing this, the virus is unable to replicate as fast as it normally would. And so the patient should get better sooner and have a milder disease.
Now, this type of therapy was actually used before in some major cases. I'm thinking of MERS, of SARS, as well as the Ebola virus. What were the success rates during those type of trials?
So SARS had very good success rates, as did H1N1 flu. Unfortunately, with Ebola, the convalescent plasma was used as compassionate use, so it wasn't used in clinical trials, and therefore, at the end of all of that use, nobody was able to determine whether it was successful or not, because if you don't have a control arm to compare to, you can't tell whether the patient would have it anyway. So it's very important that if you're going to be trying out a new therapy that hasn't yet been proven to work, that it is done through clinical trials so that you can be sure that this has actually worked. And with SARS-CoV, the first one, and with MERS, that was done properly.
So when will this trial begin, and what are the objectives? Are we trying to find a cure here? Are we trying to alleviate symptoms? Are we trying to improve recovery? What is the objective?
So the first phase, so we've got two phases to this trial. So the first phase entails the processing, the testing, and the storage of the plasma. That's already started, and any person who is eligible and has recovered from COVID-19 and would like to participate can register on our website. The second phase is a prospective randomized placebo-controlled blinded phase 2 clinical trial. And we plan to treat patients who have got a moderate or severe COVID-19. The second phase, we're hoping we'll be able to start in around June sometime, once it's been approved by SAPRA.
And who is eligible?
So donors so primarily the person must have had a positive RT-PCR COVID-19 test in the past, has now recovered from the illness. We require that at least 28 days have passed since the donor's last COVID-19 symptoms. In addition to that, they must also be between the ages of 18 and 65 years old, a female who has never been pregnant, or a male donor, and they need to weigh at least 55 kilograms. And of course, they also need to meet the normal donor criteria to donate blood, such as having acceptable iron levels, being in good health, and having lived a safe lifestyle in the last 3 months.
Before I let you go, Marion, are there any side effects to this?
So at the moment, the treatment is not proven. One of the side effects of plasma, which is something that we do transfuse regularly, one of the side effects of plasma is TACO, which is it's TACO, and there's also TRALI. So TRALI is the one that we're really worried about, which is transfusion-related acute lung injury. And these patients already have normally develops due to HLA and H bodies. And people who normally develop those are females who have ever been pregnant. So that's why we are to mitigate that risk, we are not collecting plasma from females who have ever been pregnant.
All right.